Hello, Jordan Gascoigne again here, although my last name will be changing to Draper in the near future, so I'm including both names in this video. I am a licensed health, life, and Medicare insurance agent at Supplement Plan Advisors Agency, and I offer free Medicare guidance. You never pay a penny for my help. I'm going to explain what happens when you work past age 65 in this video. When you turn age 65, you can go on Medicare. But if you are still working, you may be able to delay Medicare and stay on your insurance plan through your employer. Many people are confused about this. They think that they will get a penalty if they don't sign up for Medicare when they turn age 65. Well, that is only true if the insurance through your employer does not meet the standards. As long as you have creditable group insurance through your employer with over 20 employees, you will not get a penalty for delaying Medicare. The criteria that the insurance through your employer has to meet is that it has to be group coverage defined by the IRS, and it has to cover your drugs as good or better than the standard set by Medicare. You would want to check with your current insurance provider and ask them if your plan qualifies. I have only seen a handful of people where their employer coverage did not fit these guidelines. If your employer has less than 20 employees, then you would usually want to sign up for Medicare either way, because then Medicare would pay first and your plan second. This could save your employer money, and they may even require you to do so. Again, to be sure, contact your insurance provider or whichever carrier that you have your insurance through, and your benefits administrator, like the human resources at your workplace. Ask them both if your plan is group coverage defined by the IRS and it has creditable drug coverage pertaining to Medicare. This is also true if you have coverage through your spouse. Let's say Jim and Sarah are married. Jim and Sarah are both on Sarah's group insurance plan through Sarah's employer. If Sarah is 62 and still working, and Jim turns 65, the same scenario is true. As long as Sarah's coverage is a group plan and has creditable drug coverage, then Jim may decide to stay on Sarah's group plan and delay Medicare until Sarah decides to retire years later or whenever she drops her group insurance plan. Whenever Sarah does decide to retire or leave her group plan, or anytime Jim is going to be without insurance, that is when Jim would want to go on Medicare. He can do this years later and not get a penalty as long as he has been on Sarah's insurance and follows a couple simple steps. To get on Medicare at that time, he would first need to get a specific Medicare application form filled out by Sarah's employer stating he has been covered by Sarah's group plan. He would then fill out an application and bring these forms to his local Social Security office. He can send them by mail too, but we always recommend handing the forms in person and making sure they don't get lost in the mail. It may take several weeks to get your Medicare card after handing in the forms, and then you would want to meet with a licensed agent, like someone here at Supplement Plan Advisors Agency, where we offer free Medicare help, and decide on a Medicare supplement or Advantage plan to cover the costs original Medicare may not. So you would want to get started on this a couple months before you want Medicare to actually start to make sure you have all your ducks in a row. We can explain all of this totally free to you in more detail, give you step-by-step instructions, and give you the forms by calling us at the phone number listed on your screen or emailing us. You can also find these forms yourself by going to Medicare.Gov. When you delay Medicare, you are delaying coverage for medical services. Some people ask me why they would want to delay it. The reason is because there is a cost for having Medicare Part B. And if you have insurance through your employer already, it would be kind of silly to pay for insurance through them and pay for Medicare. It would be like paying twice for the same categories of medical coverage. Even though you can delay Medicare if you have insurance through your employer, that doesn't mean it is always the most cost-effective thing to do. It really depends on what you're paying to have your insurance through your work, your cost sharing, your deductible, and max out-of-pocket. It is always best to do a comparison when you're turning age 65 because it might make sense to go on Medicare even if you can keep your insurance through your employer. The cost on your group insurance plan may be higher than going on Medicare. At Supplement Plan Advisors, we have clients coming in all the time that tell us they aren't ready to retire at age 65. But they don't know what to do about Medicare. We have them come in or meet with them over the phone or video calling. We ask them their costs on their group insurance plan through their employer and then we compare what the cost would be if they switched over to Medicare. I would say we have about half the people that come in stay on their group insurance plan, and half go to Medicare because it makes more sense cost-wise. So if you're in this situation, I highly advise you to meet with us or someone you trust that knows all your options and works with all the companies so that you can see the differences of each option, because every person is different and every insurance plan and company is unique. It is important to know all of your options before making your decision. For example, what if Jim and Sarah from our previous example are on Sarah's group plan through her employer, and Jim finds out he needs to have surgery on his hip? He also finds out that the deductible on his current plan is $3,000 and his out-of-pocket max is $6,000. Then it may make a lot more sense for him to switch over to Medicare to save himself a lot of money. The other thing I want to mention is I get questions about coming off a group insurance plan and going on to COBRA. If you are offered COBRA, be careful and talk with an advisor on whether this would be a good option for you or not. If you wait and don't have insurance after age 65, then you could accrue a penalty, and this penalty would stay with you most likely for the rest of your life. Again, my name is Jordan Gascoigne, soon to be Draper, at Supplement Plan Advisors Agency, and you never pay a penny for my services. I absolutely love helping people, and nothing gives me more joy and satisfaction when I am able to help. Call us today and find out how we can help you. Thank you.